So we're going to be talking about colon cancer screening and who's at risk, when you should be doing colon cancer screening, and how to reduce your risk if there are other ways aside from screening. So thank you so much for having me. It's really a pleasure to speak with you all this evening. So first, some basics on what are the colon and the rectum, and then we'll talk about colon cancer, risks for colon cancer, who should be screened, what are the different screening tests, what are the differences, the advantages and disadvantages of all of those, and how to lower your risk for colon cancer. So some facts about colon cancer: it's the third leading cause of cancer and cancer deaths in the US among New Yorkers, and that's true of both women and men. And colon cancer is actually preventable. You can remove polyps during colonoscopy that prevents their growth in the future. Polyps are benign growths in the colon. They can grow, though. They can be precancerous. And so when we find them on colonoscopy, we remove them and thereby prevent colon cancer in the future. Screening for colon cancer has two purposes. It is to prevent colon cancer by finding and removing precancerous polyps, but also to detect colon cancer at an early stage when it's still treatable and even curable. So those are the two reasons that we do colon cancer screening. So some basics on anatomy about the colon and the rectum, because we're talking about colorectal cancer. The colon and the rectum are part of the digestive system. Food is digested from the mouth into the esophagus and goes into the stomach and the small intestine, where a lot of the digestion happens, and then moves to the colon, which is also known as the large intestine, or the large bowel is another term you might hear for it. The colon's job is to absorb water, and then waste, which is stool, moves through the colon and into the rectum and then gets deposited when you have a bowel movement. The colon is about 5 to 6 feet long, and that's the organ through which we do a colonoscopy. Colon cancer is a type of cancer that begins in the large intestine, or the colon. As I said, it usually begins as small clumps of cells called polyps that form in the colon, and then over time can grow and become polyps. Become cancer. And a polyp, this is a picture on the left. It's a little growth sometimes with a stalk, or sometimes it's flat against the colon. And then a colon cancer is a larger mass. And both of these views are views on colonoscopy, or on a picture of the colon. And then rectal cancer is specific to the rectum, but very similar to colon cancer. And some of the risk factors are having had colon cancer or colon polyps in the past. And we'll go through some of the other risk factors that are both dietary and modifiable risk factors, like certain lifestyle habits. So here are some of the colorectal cancer risk factors. So age over 50, and actually that's now considered even a little, that's outdated now. Actually, it's older age, starting at age 45. Is a risk factor for having precancerous polyps and colon cancer. Having a family or a personal history of colon cancer or colon polyps puts you at higher risk for colon cancer. If you have certain genetic mutations that run in your family, that can put you at higher risk for colon cancer. Being African American or Black has been shown to be associated with higher rates of colon cancer. Having inflammatory bowel disease, either Crohn's disease or ulcerative colitis. Having diabetes. Drinking alcohol and smoking cigarettes, and then eating a large amount of red or processed meat in your diet. And finally, obesity has been shown to be a risk factor for colon cancer. Things, though, that decrease your risk for colon cancer that you can do in your daily life: being physically active, taking a baby aspirin every day has been associated with lower risk of colon cancer, having a colonoscopy, removing polyps, and eating a diet that's high in fiber. So meaning fruits, vegetables, multigrains, and also dairy. So things that you can do during your daily life. So maintain a healthy weight. Definitely avoid smoking. That's good for you for prevention of many types of cancers, including colon cancer. Getting regular exercise, limiting your diet in red and processed meat, and eating a diet in high fiber that's high in fiber, and then drinking alcohol in moderation. And the other things that you can do, starting at age 45, you should begin colon cancer screening. So who should be screened for colon cancer? So this is all men and women starting at age 45 through age 75. And even after age 75, you can consider screening up until age 85 if you're still someone in good health. And especially if you've had polyps in the past, we would consider continuing screening up until 85. But it's strongly, strongly recommended to begin at age 45 and go through age 75. Now, the 45 recommendation is something that is new, actually. It used to be that we recommended starting at age 50 for colon cancer screening for all average risk individuals. In May of 2018, the American Cancer Society actually updated their guidelines to suggest that we should be screening people, all average risk people, starting at age 45. And this is based on data that colon cancer incidence is happening in younger people. And it wasn't just the American Cancer Society, they were the first, but then in the last year, all other societies who make these recommendations have come to agree with the American Cancer Society. And so now it's recommended across the board that people should begin at age 45 for cancer screening. And that's a good thing that all the societies now agree, because it means that insurances will now also cover colon cancer screening beginning at age 45 for all average risk individuals. Now, there are some people that should begin earlier than age 45. So I said that people at average risk should begin at 45, but people who are at high risk should start screening earlier. So those with a family history of colon cancer and a first-degree relative should begin at age 40, or they should begin 10 years prior to the diagnosis of that first-degree relative, whichever comes sooner. First-degree relative is either a parent or a sibling. So if a parent or a sibling has had colon cancer, you should begin screening earlier, either at age 40 or 10 years before that person was diagnosed. If you've had polyps in the past because you had a colonoscopy for a different reason before you turned 45 and you had precancerous polyps, then you should consider continuing your screening colonoscopies after that. And then if you carry, you and in your family carry genetic mutations or inherited mutations that put you at higher risk for colon cancer, you should begin screening earlier as well. So what are the options for colon cancer screening? So colon cancer screening, as we said, means checking the colon and rectum for cancer before there are symptoms or problems. Average risk people, as we said, should start having colon cancer screening at age 45. And here are the different screening tests. So there are stool-based tests or fecal tests. There's 3 different options for those, although 2 are more highly recommended. Both FIT, which stands for Fecal Immunochemical Test, or Cologuard are the stool tests that we use most often, or you can have colonoscopy. And I'll go into more detail about these options, both stool-based testing and colonoscopy. So the take-home fecal test, the other one, by the way, FOBT, which is fecal occult blood test. So a FIT, fecal occult blood test, and then Cologuard. It's when you're given a kit to take home with you to collect your stool specimen at home, and then either bring back to a laboratory or mail it in the case of Cologuard. And the fecal test results, if they are abnormal, then the recommendation will be for you to have colonoscopy. What do these tests test for? So they test for microscopic blood in the stool that you can't see but can be associated with having colon cancer or very large polyp. And then Cologuard in particular tests for both microscopic blood and then also DNA that's associated with colon cancer with a tumor in the colon. So that can be picked up by the stool test. The fecal occult blood test, you have to be on a specific diet in order for the microscopic blood not to be detected, because if you are eating a diet that's anything with iron in it over the days leading up to you doing the test, you can have a false positive. The other 2 have fewer false positives. That's FIT and Cologuard have fewer false positives. This is a little bit more detail on the FIT test, which is the fecal immunochemical test. As I said, it tests for blood cells or microscopic blood in the stool that can indicate that there's a large polyp or even a cancer in the stool. It's just a one sample, whereas just like Cologuard, there's just one sample that you need. As with FOBT, you actually need 3 samples. Another advantage to this test over the FOBT, and then the Cologuard is the same as well, that you do not need any dietary or medication restrictions while you're giving your stool sample. In this case with the FIT, you use a paintbrush to collect the stool sample and then paint it on a card that you're given. And again, if the test is abnormal, then a colonoscopy will be done. A FIT test should be done every single year, each year. Cologuard should be done every 3 years. So that's how frequently you do the stool-based testing. Now, colonoscopy is a test that's more sensitive. So FIT and Cologuard are very good at detecting cancers when they're at an early stage before they become symptomatic. So before they're causing you symptoms, they're not as good, nearly as good at detecting the precancerous polyps. And that's what colonoscopy is really good at, in addition to detecting cancers at an early stage. It's an examination when a scope with a tiny camera at the end is inserted through the rectum and then advanced through the entire colon. And then once the scope is inserted all the way through, then the endoscopist, the person doing the test, usually a gastroenterologist, slowly withdraws the scope and does a very complete and thorough examination for small polyps and then also anything that might be larger. So it's used to diagnose colon and rectum problems in general. So it's not just used for colon cancer screening. If you had another issue where you had blood in your stool, if you were having lots of diarrhea, we didn't know why. Sometimes we do this test for diagnostic reasons as well, in addition to colon cancer screening. And that's because we can do biopsies of the colon during colonoscopy, and we can also remove polyps. This is a test that can be uncomfortable to have done, and so it is done with medication through an IV so that you're asleep and comfortable for the procedure. The other thing to know about colonoscopy is that your colon must be completely clean, free of stool, for us to adequately do the exam. So you do need to drink a large amount of a liquid laxative prep the night before and the morning of the procedure to clean out the colon so that no stool is left over, so that every surface can be seen, because again, we're looking for small polyps often. And we remove those polyps during colonoscopy. So during the colonoscopy, we're looking both for cancer, but also polyps. Polyps, when we find them, we remove them during colonoscopy. This picture shows you a snare placed around the stalk of a polyp, and then the snare just cuts off that stalk. Very little bleeding occurs, and it's not painful because these are very, very small. The camera magnifies it, but these are typically less than a centimeter, these polyps. Once the polyps are removed, they're sent off to a pathology lab, and we see if they are the precancerous kind or not, because some polyps are not the precancerous kind. They're completely benign. We don't worry about them at all. But if they are the precancerous kind of polyp, then we'll recommend that you have a colonoscopy sooner than 10 years. If you have your colonoscopy and you have no polyps at all, or no precancerous polyps, then you don't need another one for 10 years. If you do have 1 to 2 small precancerous polyps, you're still good for 7 years. And if you have more than that, then we would recommend more frequent colonoscopies, something like like 3 to 5 years. And so you can see that that 10-year gap is a lot longer than a 3-year gap you're given for Cologuard, or the 1-year gap you're given for the FIT stool. Finds both the precancerous polyps and colon cancer. And so it's more sensitive. And then just one more point to make, just to really drive home what the advantages and disadvantages are of stool-based testing versus colonoscopy. Stool-based testing, you don't have to go through a prep. You don't need to go through a procedure with sedation. And it's good at detecting cancers at an early stage. But colonoscopy is not only very good at detecting cancers at an early stage, but also detecting the precancerous polyps, and because of that has just to keep in mind. So just to remember, colon cancer can be prevented. All men and women 45 years and older should be screened. Talk to your doctor about which test is right for you, because if you've ever had any symptoms that are worrisome, if you have a family member, even with polyps, we might suggest that you just do colonoscopy rather than a stool-based test. And also, if you have a medical problem where undergoing sedation might be a problem for you, we might recommend that you have a stool-based test instead. But either way, you can lower your risk of developing colon cancer, but also developing later stage colon cancer. And these are just some resources that we provide you with at the end here to call and try to find a place where you can have your colon cancer screening done. And hopefully this will be provided to you by the hosts as well. So thank you, and we'll take any questions now.